Eric, let's go to the kind of the key indicators today. We're 1,345 cases and 50 deaths. So certainly not good. It's consistent with what we've seen. We've sort of hit a plateau, and we certainly can't drop below 1,000, and we're around the 1,300. That continues on. The sad note, of course, 50 deaths reported to the Department of Health since yesterday. It's the highest number of deaths reported to the Department of Health on a single day since June. We're also reporting 89 new hospitalizations and 14 new ICU admissions. Eric, let's go to our top 88 counties. As you recall, we have started doing this a few weeks ago, really just trying to do the snapshot of 2 weeks to see how many cases each county had, and then we equalize that out by putting it per 100,000 population. So you'll see those counties. Let's go, Eric, to the 10, if we could. And you'll see Putnam County, and then Montgomery County, Meigs County, Butler County, Jackson, Darke, Shelby, Mercer, Henry, and Auglaize. And again, most of these counties, 9 of these 10 counties are fairly rural counties. Butler is certainly not a rural county. At least most of it is not. But so that really leaves 8 that are pretty much rural counties. Let me kind of go through these for a moment. So Eric, let's go to the map now. So this is the new map. 67 of our counties stay at the same level as they did last week. The greatest movement happened with 12 counties moving down from orange to yellow. We'd like to see that. We now have 39 yellow counties, the highest number we've had since July 2nd. The population of Ohioans living in counties, yellow counties also hit a high. To date, 26%, a fourth of all Ohioans are now living in a yellow county. So that's an improvement. Lorain County dropped 2 levels this week from red to yellow. And frankly, we asked what was going on in Lorain. Local health department officials tell us that more residents are following the protocols or wearing their masks. Residents also are using caution when planning gatherings, are taking the health department's recommended protocols into consideration when making those plans. Certainly great news, but we still have counties that are red. 7 counties this week: Butler, Lucas, Mercer, Montgomery, Preble, Putnam, and Wayne. Let's start with Putnam County, which, as we said, has the highest rate, 268 cases per 100,000. So they are at number 1. They're red for the first time this week. They've seen a sustained increase in new cases. During the past 2 weeks, they've had 91 new cases out of a total of 358 cases during the entire pandemic. That's a quarter of all the cases they've had just in the last 2 weeks. They've increased from an average of 3.6 cases per day on August 15th to an average of 9.3 cases per day on August 26th. County has also seen a sustained increase in emergency department visits for COVID-like illnesses, which of course are the early warning signs. The cases they're seeing are primarily associated with family gatherings and community spread. Let's go to Montgomery County. They remain red this week. They've had 19.3% of their cases during the past 2 weeks. That's 1,191 new cases in 2 weeks compared to 6,146 total cases since the beginning of the pandemic. They're seeing a sustained increase in outpatient visits for COVID-like illness from an average of 36 visits per day on August 24th, now to 46.3 visits per day. We are seeing, of course, some of this is being driven by what's going on at the University of Dayton. The university is scheduled remote learning through September 14th to help mitigate the spread. Local health department is working with UD on contact tracing and messaging. Montgomery County also has several long-term care facility outbreaks, which local health department is working on. Let's turn to Butler County. Sadly, Butler County returns red this week. They've had 841 new cases in the past 2 weeks out of 4,300 total cases since the beginning of the pandemic. That's a 19% of their total cases have occurred during the last 2 weeks. They're also seeing an increase in outpatient visits for COVID-like illness from an average of 58 visits per day on August 21 to 73 visits per day on average on September 1. Miami University is certainly impacting cases for Butler County. They've had outbreaks associated with students attending house parties. And again, let me just say, we're seeing this throughout the state. We're seeing University of Dayton, we're seeing Ohio State, we're seeing Miami, we're seeing some at UC and other places. But I think the good news is that when you're seeing those cases, that means there is testing. That means the university is being aggressive in going after this problem. And as I will talk to Dr. Crawford in a moment, again, our message to college students is the same message that presidents have had for the college students in pretty blunt terms. And that is, if you want to stay here, if you want to stay in class and have a college year, things have to be different. Have to wear masks, have to not go to large parties, have to keep the social distance. Let's turn to Mercer County. Continues red this week. The county has had 72 new cases during the past 2 weeks, which is almost 9% of their total cases since the beginning of the pandemic. Mercer County continues to have community spread. So we just asked our friends in Mercer County, wear masks and social distance. Very important. Preble County remains red this week because they meet the CDC's threshold for high incidence, 122 cases per 100,000. They've had 50 new cases during the past 2 weeks out of 358 total since the beginning of the pandemic. That's a 14% increase. That's 14% of their total cases have occurred in the last 2 weeks. They've had outbreaks in a group home and have worked hard to control a large outbreak in a long-term care facility. Lucas County remains red this week because they meet the CDC's threshold for high incidence, which they're at 112 per 100,000 population. They've had 481 new cases in the past 2 weeks. They've had several long-term care facility outbreaks that local health department officials are in fact monitoring. Wayne County is red for the first time this week. Cases have increased from an average of 5.5 cases per day on August 15th, now to an average of 12.1 cases per day. They've had 104 new cases during the past 2 weeks. They're also seeing a sustained increase in outpatient visits for COVID-like illness from an average of 4.6 visits per day on August 25th to 9.6 on September 1. The county has had several outbreaks in business and churches. There also is a large long-term care facility outbreak. The local health department has been working on this, and we continue to keep in touch with them. Let me just talk about, we've shared in the past some stories about how we're seeing, just anecdotally, how we're seeing the spread. We're in Cincinnati, multiple off-campus parties with students attending from several universities on August 14th have resulted in at least 78 confirmed cases so far. Up in Wood County, there were small social gatherings that led to a few cases, but those who have been exposed have now spread the virus to multiple people. The county has 15 confirmed cases associated with a university move-in day on August 27th. Again, these stories show us how quickly this virus can spread. Again, to emphasize, we can get it from our friends, we can get it from our family, because so many people, particularly young people, don't show signs of it. Sometimes it's very difficult to know if they have it. It's impossible to know, and they don't know that they have it. That's why it's so very important for us to be careful, and very important for us to be careful this weekend.